So when we are setting up a patient to be tested on the Max Pulse device, it's important that their feet are both flat on the ground, legs uncrossed. We want to make sure that the finger probe is on the left index finger with the cord on the probe on the top of the finger. We want to make sure that the patient does not have acrylic nails because that chemical in the acrylic will affect the reading. We want to make sure that the patient has not had any caffeine in the last 4 hours. We know that caffeine will elevate the heart rate, and caffeine is also a vessel constrictor. So when we're testing circulation, obviously we want to make sure we have an optimal amount of circulation. Also, we want to make sure that the patient is warm. Again, we're testing circulation, so we want an optimal amount of circulation. So generally the best thing to do is just make sure that they're warmed up. If they're not, the best thing to do is you can have hand warmers, or you can just have the patient take their left hand and obviously under the armpit, one of the warmest spots in the body, get that warmed up, finger probe on, make sure that they are in a resting state, and make sure that their eyes are open. You want to make sure that they understand that they shouldn't be talking or moving for the duration of the test. So the first thing I do when I sit down with a patient is I want to make sure that they understand that you can have blood pressure that's 120/80 and you can have a lipid panel that is optimal and you can still be susceptible to a heart attack or stroke. We want to make sure that the patient understands that what we're testing with the Max Pulse, most of the time they're going to be asymptomatic. They're not going to feel that they have a suboptimal remaining blood volume score. They're not going to feel that they have a suboptimal elasticity score. We want to make sure that the patient understands how impactful this test is for early detection. 50% of the population is going to become a statistic due to heart attack or stroke. So we really have to make sure that our patients are tested on the Max Pulse device and they understand their results and they understand that they're very rarely going to see symptoms in regards to this disease. Now, the Max Pulse is picking up signal from the right atrium of the heart. That signal, what the Max Pulse is doing is mapping the entire cardiac cycle. Every single heartbeat will fall into one of the 7 waveform types. You see here the entire cardiac cycle is being mapped. A type 1 waveform pattern, this is what's considered a perfect heartbeat. We see we have a nice steep incline here. We have a nice steep rebound here. And we have little to no atherosclerosis progress. Obviously, as the waveform patterns increase, as does the atherosclerosis progress. So in 3 minutes, the device is going to let us know what percentage of the patient's heartbeats fell in each waveform type. We want to make sure that the patient understands that we're looking at the state of their body. We don't want them to justify that they have type 5 waveform patterns because they're 70 years old. No matter what our age, we want all of our waveform patterns to fall at type 1 and type 2. When we're looking at this sample report, we see that this patient has 90.9% type 1 waveform patterns, 8% falling at type 2, and 1.1 falling at type 4. So majority of their waveform patterns are falling at type 1. We move down to the DPI, differential pulse wave index, the overall health of our cardiovascular system. We have eccentric constriction, EC, arterial elasticity, AE, remaining blood volume, RBV. Now, when we input the patient's information, the device will ask for the patient's date of birth and their gender. In this section of the results, the patient is being ranked up against their peers. They're being ranked suboptimal, normal, or optimal. We have to make sure that the patient understands what the average state of cardiovascular health is amongst their peers. So when 50% become a statistic because of this disease in North America, and that's what's considered normal, we have to make sure the patient understands that they do not want to rank normal in regards to these results. So we look at contraction, which is the eccentric constriction score. We're looking at left ventricular output. Most patients know they want a strong heartbeat. 83.25, falling in optimal range when being compared against our peers. Arterial elasticity, 73.56, again, falling in optimal range. Remaining blood volume, 60.72. So we're about 10 points away from optimal range. So we could definitely speak to the patient about improving that remaining blood volume score at diastolic function. Now, when I'm going over the front half of this test, which is the aging vascular health, I want to make sure the patient understands that these results are not going to change on an hour-by-hour or day-to-day basis. We want to offer a treatment protocol, and we want to incrementally move these results over a 90-day period and retest. When we move to the back half of the test, when we're looking at what's called our frequency domain, our stress scores, our autonomic nervous system. Our autonomic nervous system is changing minute by minute. Now, let's talk about the frequency domain. The frequency domain, we look at the device picking up an impulse from the SA node. And what happens is the device takes that impulse and breaks it down into 3 specific frequencies. We have our very low frequency, our low frequency, and our high frequency. Now, how we arrive at how balanced our autonomic nervous system is, we talk to a patient about the autonomic nervous system as being the control panel in the body. We have our sympathetic and we have our parasympathetic. Our parasympathetic is our rest and repair. It's also known as our brake. Our sympathetic is our fight or flight, our gas pedal. We want those in perfect balance because when they're balanced, that means that the autonomic nervous system is in perfect communication with other parts of the body. Now, your high frequency is a very parasympathetic driven frequency. Your low frequency is both parasympathetic and sympathetic driven. Your very low frequency is a very sympathetic driven frequency. So we're going to arrive at that sympathetic or parasympathetic balance or lack of balance based on how strong, how powerful these frequencies are coming in. The average of the 3 frequencies is what's called our total power. Obviously, if you ask a patient if they want a lot of force, a lot of power behind that heartbeat, they know that they do. We want as much force as possible. So now we're going to be able to let our patient know where they stand as far as how electrical output coming from the SA node. That's how we arrive at the frequency domain, and that's how we arrive at their total power score. We're going to be able to let the patient know how balanced or out of balance their autonomic nervous system is. And then what happens is we're going to arrive at our stress scores. We look at physical stress. Physical stress, if our body's having to overwork, it may or may not show us a symptom. But if our body has to overwork, that is going to elevate the physical stress on the body. If we have weak power or a weak frequency domain where we don't have these 3 frequencies coming in strong, we're going to arrive at a high or very high stress score, physical stress score. Physical stress and stress resistance have an inverse relationship. The higher the physical stress, the lower the stress resistance. And the body obviously is going to have a hard time combating disease when it's overworking. Our mental stress, we arrive at our mental stress score looking at how balanced the autonomic nervous system is. Obviously, we want our autonomic nervous system in perfect communication with our cardiovascular system. All right, when we're covering the frequency domain, we need to remember what we're doing is the device is picking up the signal from the sinoatrial node and breaking that impulse down into 3 frequencies. So we look at our very low frequency. Our very low frequency correlates with how well the body is managing hormone regulation and body temperature regulation. We look at our low frequency, and that correlates to how well the body is managing energy levels. We look at our high frequency. Our high frequency correlates with the stress and aging process. So we want to make sure that these frequencies are coming in strong, coming in powerful. These black eye bars on the report are not going to move. Standard deviation, but obviously what we want to move are the graphs, because the higher the graph, the stronger that frequency. The 3 frequencies together, the average, that's how we arrive at our total power score. We move to our physical stress score. Physical stress has an inverse relationship with stress resistance. Obviously, if your body has less physical stress, the body's going to be able to combat disease more easily. Therefore, we have higher stress resistance. When we look at mental stress, we're looking at the balance or lack of balance in the autonomic nervous system. And when we arrive at our stress score, the goal is to have a stress score under 50. That would be ideal. When we move to the top of the report, we see we have a high heartbeat and we have a low heartbeat. And then we move to an artifact beat. An artifact beat is generally caused by talking or movement. It can also be caused by caffeine. An AFib patient, we will generally see that show up in the artifact beat. We want to make sure that we don't have any more than 6 artifact heartbeats in one test, or we need to retest. So we see on this report that the patient has 44.2% of their waveform patterns coming in at type 4. We see that they also have 11.5 at type 5, 0.6 at type 6, 1.3 at type 7, 31.4% at type 3. So we know that we want to help the patient move all of those falling type 3 and higher. We need to move those. We need to move those to type 1 or type 2 waveform patterns. We also see that the eccentric constriction, that left ventricular output power, 43.02 points. So we're falling on the low end of normal in regards to contraction power when we're being ranked up against our peers. Obviously, the patient knows that that is not where we want to stand, on the low end of normal. We're at 2 points for elasticity, arterial elasticity. We know that a patient, as they age, their vessels are generally not going to become more elastic. We know at 2 points we're at suboptimal. So we definitely have some work to do improving that score. Remaining blood volume. We're looking at diastolic function here, 28.90, so we're still falling at suboptimal. So we want to make sure that the patient understands, first of all, that the body has a natural process to remove plaque. In 1998, Dr. Louis Ignarro won the Nobel Prize. He wrote this book, great book for a patient, physician, nurse. He took all of his Nobel Prize research and put it in a book for a layperson. What he talks about in his research is that obviously he proved that nitric oxide is a signaling molecule in the cardiovascular system. So when I talk to a patient about that, I want to make sure they understand, again, every single day the body has a natural process to remove plaque. It's called nitric oxide synthase. In this research, what happened is they proved that there are small cells in the vessel called endothelial cells, and when they release nitric oxide, it will dilate the vessel. And obviously when we dilate something, we're making it bigger. So we've got more circulation. Nitric oxide is a gas. So the nitric oxide is also able to go in and break down the plaque the white blood cells, the lipids, and that's the natural process of nitric oxide synthase, breaking down that plaque, those white blood cells, and taking it out of the body. What happens is as we age, we have a sedentary lifestyle, poor diet, inflammatory issues, genetic factors, our body starts doing less and less of this function. So in Dr. Ignaro's research, he found that if you take L-arginine and an amino acid, L-citrulline, which is a citrus-based amino acid, in the right ratio, it will create what's called a recycling pathway. And nitric oxide synthase, this function of vasodilating the vessel, can extend up to 36 hours. So when we're recommending to a patient the nitric oxide protocol, we work specifically with a company that manufactures a product, ProArgi-9. And the reason why we work with the product ProArgi-9 is because in every one serving there are 5 grams of L-arginine and 0.5 gram of citrulline. And this product comes with a 4-month money-back guarantee. And it's also the product that is used at the High Desert Heart Institute. So we work with this specific company because this is the exact product that's used at the High Desert Heart Institute in Victorville, California. The patients, 33 of them, were put on a 4-serving-a-day, 4-month protocol of the ProArgi-9. At the end of 4 months, none of them needed a new heart. All of them are still alive. And there were amazing changes on the pre and post labs when we're looking at blood chemistry. When we're looking at recommending the ProArgi-9 to a patient, we want to make sure that they fully understand that the ProArgi-9 is not something that they can go get at a store. We want to make sure that according to Dr. Ignaro's research, we need at least 3 to 5 grams a day, and that's a wellness, a therapeutic dosage. So they need to understand that this product, the ProArgi-9, there's 5 grams of L-arginine in every one serving, and we minimum want to have them on 2 servings a day. Now, if you can imagine a V, we have L-arginine, nitric oxide, ADMA, asymmetric dimethyl L-arginine, which is another amino acid that actually inhibits nitric oxide production. So if you find that a patient isn't getting optimal results from the ProArgi-9 protocol, we need to increase their dosage. Patients in the High Desert Heart Institute, they're on 4 servings a day. So you can increase the dosage anywhere from 2 to 4 servings per day. Now, we need to make sure that we understand that sometimes we need to titrate a patient up as far as dosage because many times patients are amino acid deficient. And so when we come in and we start on a daily basis, they're on 10 to 20 grams of arginine overnight, that can cause some digestive issues. They may experience some diarrhea. Again, this is a healthy process. When we look at sitting down with a patient and going over why the ProArgi-9, we want to make sure that they understand that most of the arginine products that are out on the market are 500 milligram capsules of arginine, and there's no citrulline present. And we know based on this Nobel Prize research that we've got to have high levels of arginine, and it's got to have the right ratio of citrulline because citrulline is what creates the recycling pathway. We want to make sure the patient understands that they're on the exact same product, maybe not the same dosage, but the same protocol that the patients go through at the Heart Institute. Now, when we look at a patient that's on medication, this product is not a synthetic product. The body knows what to do with the ingredients in this product well before a drug because the ingredients in this product are derived from food. So we know that we can continue to have a patient on the Pro-Arginine protocol and know that the body is able to break down these ingredients, and we know that nitric oxide synthase is a normal, natural function that we have to do every day. And the goal is that we help the body create a healing environment and that they will be able to titrate down off of the drugs, the pharmaceuticals. Okay, so when we look at educating the patient on the treatment protocol, we have a 4-page document that is a brief overview on the High Desert Heart Institute study. We have a document, 22 reasons to use L-arginine. This is a fantastic document because you've got obviously the top 22 reasons broken down by different systems in the body, from enhancing memory to treatment of asthma to pregnancy-related hypertension. And then on the back of the document, you have the medical citations. So the patient can actually take this document home, type in the medical citation on the internet, and it's going to actually pull up the entire study. So you move from the High Desert Heart Institute to the 22 reasons to the patient education trifold brochure. Those would be the top 3 patient education materials to be giving out. And then we also have a marketing stand that's basically a profit center piece that will go in your waiting room. So while your patients are waiting, they can educate themselves with the trifold brochure. That education will stimulate questions for you, the staff or the doctor. That way they can get their questions answered, get tested on the max pulse, and then we can help them increase their max pulse results with the Pro-Arginine treatment.